So 1.5 years ago, we started a trial. It was a company-sponsored trial to see whether bispecific antibodies, in this case CD3, CD20, Epcoritamab, will be effective in CLL and in Richter's transformation. And that's a maybe challenging path because we know that you have on one side a lot of tumor cells in the blood, so you have bulky disease, but then in a leukemia form, which might cause maybe additional toxicities. And on the other hand, you have this T-cell dysfunction, which is very characteristic of CLL. So it was a very exciting way of checking this. And what we have done is we treated now 23 patients with monotherapy. And those patients were very refractory, so a lot of them were double exposed to BTK inhibitors and BCL2 inhibitors. The majority had 17p deletions or p53 aberrations. And what we did see is, if you first look to efficacy, is that it was very effective, I have to say, in this patient group. Is more than half of the patients got an overall response, and approximately 1/3 got a CR. And if you look to MRD data, you actually saw that all the patients with CR had undetectable MRDs, and half of the patients with a PR got undetectable MRD. So I think for a monotherapy, end of the road, phase 1, phase 2 trial, those are really remarkable numbers. Then, of course, you have to discuss side effects. So we did see patients with cytokine release syndrome, which is a very typical side effect of bispecific antibodies. But they were mostly grade 1 and 2. Very few had grade 3. They're all resolved. They all came very early and actually were pretty manageable. And the most cumbersome maybe side effect of this kind of treatment is ICANS. This is immune-related neurotoxicity. We did see that in very few patients. Also, that was manageable, but that's really, we think that for the future of this drug, we need to have a close eye on. And for the future, I think very much that could be a very good drug to given together with the targeted agent. So within the HOVON group, we're going to do a trial with a venetoclax combination and one with a non-covalent BTK inhibitor.